Hello, I'm Dr. Suddhasattwa, Senior Consultant, Surgical Gastroenterology, GI Oncology, Laparoscopy and Liver Transplant, presently associated with AMRI Thakuria Hospitals, Ashok Nursing Home in Jodhpur Park and KDQ Center being my chamber. I was a former Senior Consultant with the Fortis Group of Hospitals, Director of Medica and Apollo Group of Hospitals. What is the most important thing from the patient's perspective is the finances, because not all of them are covered by the insurance. Even when they have insurance, the insurance may not cover for the surgeries to that extent, or maybe a limited insurance, or because what happens is liver cancer, gallbladder cancer, bile duct cancer, pancreatic cancer, colorectal surgery, these are expensive surgeries. Not because it is expensive because of the disease per se. This is a big operation, needs big OT, expensive instruments, expensive tests, so as to give a relatively certain result. Now always there are two ways to diversify. One is to give a quality. Now whenever you want to hold on to quality, you would not like to compromise on medicines, consumables, disposables, even the surgical charges. The surgeon may be very experienced senior. So what happens? The charges are slightly more. If you on the other hand go to a public sector or maybe in the periphery, the cost may be slightly less, because the cost also varies from tier 1, tier 2, tier 3 cities. Now what is very important here is not just the cost, it is the cost benefit ratio. I would like to put forward from my extensive experience of 20-30 years being a hepatobiliary pancreatic GI surgeon, that whenever you try to restrict cost, what happens is the doctor will become more conservative in trying to avoid medicines, or maybe some amount of compromise in the instruments or some amount of compromise in the medicines. What happens is the chances of complications increase, and maximum costs are borne by patients when there is a complication, because that increases the stay, the ICU, ventilator, organ supports, medicines, bloods, etc. So best is to have a quality surgery where automatically the patient revives good without a complication, the stay is overall less, at the same time it outweighs the cost that is involved for the good quality surgery. Now what happens is, like say for example in a laparoscopic gallbladder, you can get it down for a very low cost in a peripheral small nursing home, where it can be a pretty high cost in a big corporate setup, because a lot of things are involved in the surgery. And like I said, an inexperienced relatively inexperienced surgeon may charge less, but an experienced surgeon may charge more, because that also to an extent ensures the quality and the safety of the patient. So that is completely your choice where a patient would like to go. But what is most important, the way I would look at myself, my relatives, my patients, or I would tell my patients or tell the general population is, first and foremost, choose what the right doctor, the right setup, and find out what is the right treatment. Once you have decided and you have understood the right treatment, then you get an estimate of the costs for a surgery without a complication, and then with a complication where it can go, and measure yourself, your finances, your plannings, etc., where you stand. Based on that, you may actually boil it down to 3-4 setups where there would be a different financial implications, and you choose according to your capability the place where your finances and the treatment sync best, because that is the only way to go forward, especially considering the cancers are on the rise, they are becoming more complex, the surgery is becoming more complex, the cost implications becoming more complex. So this is probably the best foot forward to actually balance the high costs, at the same time your financial status and the right treatment without compromising the treatment. Because I always say that if you are alive, if you are healthy, the money that you have lost or you have spent, that's a better way to put it, in your treatment would actually be earned back. But if you compromise too much on the financial side, choose a center which is not equipped or probably not as confident to do these surgeries, the complications will not only have cost implications but may land up in a death, unfortunate however, but the patient once is gone, I mean everything is at loss. So best is you understand everything, choose your place, and then at the same time do not compromise much on the quality. because like I said, the finances and the money would come back to you, but it is more important, life is far more important than money. So that is, you're the best judge to decide what is more suitable and comfortable for you.